Hi. Welcome back. Let's get onto the board. Epidural anesthesia. Epidural anesthesia is a type of regional anesthesia that involves injecting medication into the epidural space, which is the space around the spinal cord. It works by blocking pain signals from reaching the brain. Anatomy of spinal cord, overview. Skin. Subcutaneous tissues. Supraspinous ligament. Interspinous ligament. Ligamentum flavum. Epidural space. Dura mater. Arachnoid mate. Pia mater. Spinal cord. Vertebral column. Anatomy of spinal cord, overview. Skin, the outermost layer of the body, made up of keratinized epithelial cells. Subcutaneous tissue, a layer of connective tissue that lies beneath the skin. It contains fat cells, blood vessels, and nerves. Supraspinous ligament, a thick ligament that connects the spinous processes of adjacent vertebrae. Interspinous ligament, a smaller ligament that connects the spinous processes of adjacent vertebrae at their midline. Ligamentum flavum, a thick ligament that connects the laminae of adjacent vertebrae. The laminae are the flat plates of bone that form the posterior wall of the spinal canal. Epidural space, a potential space between the ligamentum flavum and the dura mater, which is the outermost layer of the meninges that surround the spinal cord and brain. The epidural space contains fat, blood vessels, and nerves. Dura mater, the outermost layer of the meninges, which is a tough and fibrous membrane. It is separated from the arachnoid mater by the epidural space. Arachnoid mater, the middle layer of the meninges, which is a thin, web-like membrane. It is separated from the pia mater by a narrow space called the subarachnoid space, which is filled with cerebrospinal fluid. Pia mater, the innermost layer of the meninges, which is thin and delicate and closely adheres to the surface of the spinal cord. It contains blood vessels that supply the spinal cord with oxygen and nutrients. Spinal cord, a cylindrical bundle of nervous tissue that extends from the brainstem to the lumbar vertebrae. Epidural needles pierce the following structures. Skin. Subcutaneous tissue. Supraspinous ligament. Interspinous ligament. Ligamentum flavum. Epidural space. Epidural trolley or tray. Bowl. Pyodine. McGill. 24x4 gauzes. Epidural kit, which contains epidural catheter, epidural, loss of resistance syringe, filter, 10 cubic centimeters syringe. 15 cubic centimeters Sigen. Bupivacaine, 0.5%. Lidocaine. Drape sheets. Gloves. Everything in this should be completely sterile. Types of epidural needles, commonly used. Tuahi epidural needle. Whiteacre epidural needle. Where epidural anesthesia can be administered. Epidural anesthesia can be administered at any level of the spinal column, from the cervical, neck, region to the lumbar, lower back, region. Lumbar epidural, this is the most common type of epidural anesthesia. It is used for surgery and pain relief below the waist, such as cesarean section, hip surgery, knee surgery, and orthopedic surgery. Thoracic epidural, this type of epidural anesthesia is used for surgery and pain relief in the chest and abdomen, such as thoracic surgery and abdominal surgery. Cervical epidural, this type of epidural anesthesia is used for surgery and pain relief in the neck and upper back, such as cervical spine surgery and shoulder surgery. The specific location of the epidural injection will depend on the type of surgery or pain relief that is needed. For example, a lumbar epidural injection would be used for surgery on the lower back or legs, while a thoracic epidural injection would be used for surgery on the chest or abdomen. How epidural anesthesia works. Bupivacaine is administered into the epidural space, which is a space between the dura mater, the outermost layer of the meninges, and the ligamentum flavum, the ligament that connects the vertebrae. Once bupivacaine is injected into the epidural space, it diffuses through the epidural fat and cerebrospinal fluid to reach the nerve roots. The drug then binds to receptors on the nerve roots, blocking the transmission of pain signals to the brain. Some of the potential risks of epidural anesthesia include hypotension, low blood pressure, bradycardia, slow heart rate, dural puncture, a hole in the dura mater, the outermost layer of the meninges that surround the spinal cord and brain, nerve damage, infection, headache. Contraindications. Patient refusal. Active infection at the injection site. Coagulopathy or active bleeding. Increased intracranial pressure. Severe hypotension, low blood pressure. Hypovolemia, low blood volume. Uncooperative patient. Spinal stenosis, narrowing of the spinal canal. Sepsis. Neuromuscular disorders. Allergies to local anesthetics or other medications used in epidural anesthesia. Thank you for watching this far. See you in next video. If you liked my work, do like and subscribe.